Sir Michael, thank you so much for coming and presenting at our AGM conference. You are much loved by the public health community because most of us are trying our best to tackle health inequalities. I'm wondering, since your seminal report, what progress you think has been made generally on health inequality?
Well, firstly, let me behave like the cautious person I am when it comes to looking at evidence of progress. My concern is, we did the Global Commission report, the WHO report, and you can ask, well, was that a success? Well, I can point to several countries that have taken it up. So that's in a way a success, one of which was England. Was that a success? Well, I can point to 3/4 of local authorities have Marmot implementation plans. Is that a success? Well, we're monitoring, so hopefully we'll find out. But I couldn't be more enthusiastic. I couldn't be more pleased. I mean, the idea that you do this report and local government says, how can we implement it? We want to make this the centre of our strategy to improve communities, to improve health and well-being. And in a moment, I'm going to talk to the West Midlands Fire Service. We've got firefighters out there trying to implement strategies to improve health and reduce health inequalities. We've got doctors, we've got all sorts of people who are doing this. So I couldn't be more pleased.
That's great, and I've also visited the fire service, and I think they're fabulous on that front line. And also, it seems to us that your views and the health inequalities message is being embedded, perhaps mainstreamed in some areas, so this is very good news. But I'm wondering what role you think business might play in tackling, if any.
Well, I think we need to be a bit cautious. If we think about business, I think about it in 3 ways that they potentially impact on health. They produce things, they employ people, and they have an impact on the community, the stakeholders in the community. Quite apart from the general economy, you know, without successful business, the economy is not successful, and a successful economy allows us to do things. So thriving business sector is obviously vital for the economy, that goes without saying, and that helps us do other things. But let's look at those 3 things. If business is producing fizzy drinks, then we're on a direct collision course. I don't know how we can work together. If business is producing fast food that's high in fat and sugar, then we're on a collision course, because their mission, if I can call it that, is to make more profit. And our mission is to improve the public health. And that's a direct collision course. But that's only some businesses. Others can modify their products, can think about what it is that they make in terms of the impact on the health of the public. The second, they employ people. I talked about the fact that a majority of people in poverty are working. And they're poor because they're not paid enough. A campaign for a living wage, if all businesses are paying the living wage, the competition will be in favour of the businesses that are paying the living wage. The ones who aren't won't be able to employ anybody. At the moment, people are saying, well, if I pay my workers more, then they won't come work. You know, the company won't be a success. I can't do it because the ones who are paying them less will be more profitable than my company. But if everybody's doing it, and there's a big push, and you're shamed as a business if you're not paying what? You're not paying the living? I'll go to John Lewis, I won't go to your store. And I was talking with a minister who used to work at John Lewis, and my understanding is John Lewis is a good example of having right in its charter the well-being of its workforce. And that includes paying them enough, it includes decent working conditions, it includes people feeling like they've got an emotional state in a stake in the company. It's not just some place you've got to be at between 9 and 5 to get enough money to feed your children, but it's something you want to do. So the way business employs people is potentially vital for the public health. We know about a third of the mental ill health problems in working age populations comes from the conditions of work. Wow.
That's
A
big
third
statistic.
of the mental illness problems, I'm not talking about schizophrenia, a lot of people are not working. I'm talking about the common, but very important,
Stress.
depression, anxiety. About a third can be linked directly to the psychosocial conditions of work. So businesses have an enormous role to play, not just in paying people enough, but in the conditions of work, which are vital. And then the third is the impact on their community. I remember being in a meeting in Chicago. The University of Chicago is in the south side of Chicago, which has been the poorest part of Chicago. They're trying to get the poor out so the yuppies can move in and gentrify it and so on. University of Chicago, and the chief executive of the hospitals was making a speech, and I asked him, do you give preference in employing people to the local population? Hadn't thought about it. Well, you're in the poorest part of Chicago. Giving employment to people is going to make a difference, not just to those individuals, but to the community. Because if people aren't unemployed and they've got enough money, businesses can thrive, the community, people, you know, all those good things. So they have a stake in impacting on the local community, quite apart from what we heard from Andy Haynes about CO2 emissions and being green companies and being energy responsible. That's all part of the stake that they ought to have in the social and physical environment. So I think companies have at least 3 roles to play on health and health inequality.
And I think organisations like ours and others should be perhaps talking more about that and helping get those messages out.
I think so, because we've got to find a way that, I mean, companies can talk to us and palm us off with their, corporate social responsibility. And, if the health of the public depended on corporate social responsibility, we're in serious trouble. So we've got to find a way to shame them into it, to legislate them, regulate them into it, to have a proper dialogue, so that, yes, of course, their motive is profit, of course, but they ought to have other aims too, like we were saying a moment ago with John Lewis. And it's financially, as I understand it, a successful company.
So it is indeed. Brings me to my third question, which is, we have an election in May 2015.
No, really?
Yes, and we're going to be hearing loads about it, I'm
No.
sure, bored to death with it. However, what would you be saying to government about health inequality? What would you be asking them to do if you had a couple of things that your wish list, if you like,
Well,
they would do?
Look at the kinds of data that I've just been presenting today that relate to my 6 domains of early child development, education, employment and working conditions, having enough money to live on, healthy communities, and taking a social determinants approach to prevention. Now, that evidence, and I know the Minister of Public Health listened, because she talked to me about it just now. And it's uncomfortable, but the evidence is sometimes uncomfortable. In a previous government, one minister said, "Why do you always bring us bad news?" You misunderstand research, Minister. I'm not a minister in this government, in a previous government. You misunderstand research. We bring you the evidence, not bad news or good news, but the evidence. Now, I would say, but this is me, that I would want any government to put the fair distribution of health at the centre of all their policy making. So when you stand up at a party conference or in an election broadcast or whatever it is, have regard to the distributional effects of your policy and their impact on health and health inequalities. So that ought to be at the centre. Now, you could say, well, but I've got somebody from the environment preaching at me, and I've got somebody from business preaching at me, and you're preaching at me about health. My argument is that health and health inequalities tell us a great deal about how well we're doing as a society. If, as a politician, you're saying, vote for me because I will deliver a better society, I say, and we'll know that because of the kind of policies you have and their likely impact on health and health inequalities. So my message is health equity in all policies.
We like that message very much indeed. Thank you very much, Sir Michael. Thanks for the conference and thanks for talking to me.
It's a pleasure.